Good morning, everybody, and welcome to this webinar hosted by Agilysys in conjunction with Birmingham City Council. I'm Nicola Hammond from Agilysys, and I'll be moderating the webinar for the next hour. The title for today's webinar is Transforming Care Services Through an E-Marketplace, and aims to discuss how care services can be transformed through the power of digital technology. We are really happy to welcome Peter Hay, Director of People at Birmingham City Council, who will be our speaker today. And he will reveal how Birmingham has developed a care e-marketplace as part of its long-term digital strategy, a move which has really seen the delivery of social and healthcare services transformed to meet the needs of the individual. Agilysys is delighted to have been working with Peter and the team at Birmingham City Council over the last few years, and right from the beginning, Birmingham challenged us to provide their citizens with greater choice and control over their care arrangements. And in the spirit of partnership working, My Care in Birmingham was developed, providing a suite of digital tools which are giving people more independence, choice and control, and using community assets to deliver personalised solutions. Peter is going to talk to us about the role of the e-marketplace in the delivery of care services and the part it plays in the Council's overall transformation journey. Before we get started, there are a few housekeeping points to make. If you have a question to ask Peter, please go to the box on your screen and simply type it in. We will be having a natural break point halfway through Peter's presentation where we will be taking a couple of questions. There will be a full Q&A session right at the end after Peter has spoken. So, like we said, please contribute your questions throughout. The entire webinar will also be recorded, so if you miss anything or think that a colleague would be interested in hearing it again, the recording will be available to listen to, and I'll be giving you more details at the end on that. So without further delay, I'll hand over to our speaker today. Peter, over to you.
Good morning, and what I'm going to try and talk about today is to set the scene, really, by looking at public spending, how the transformation response fits within that, and to think about whether transformation is actually over, and that what we're talking about is how e-marketplaces and digital technology may be part of a new set of values that are the approaches to the solutions facing the health and care system. I'll use some evidence that we've got and talk about how markets and shaping care, or My Care, and how it fits personally works for all of us. It's worth starting by setting out the scene that faces us with local government spending, and this slide is a reminder of the scale of the challenge facing local government in particular. Of course, it's easy to look at that and think almost jealousy across to the NHS, without also forgetting the context within all of this fits. But actually we're running the NHS within a lower percentage of GDP spent on healthcare than most Western economies. And also, it's been a matter of choice to almost halve the percentage of GDP being spent on social care over the last 8 years. And that is taking us to a point where, in the answer being integration, we're doing that on a very slim level of public investment. And we need some clarity about how we're going to achieve those ends together under this substantial challenge that faces both of us, regardless of where we come out in relation to relative cuts in expenditure. So, thinking about transformation, what we've got is a picture which shows how Birmingham has had a consistent approach to transformation over recent years. We set out to transform adult care, and deliberately used that word in 2008 to try and reduce the pressures from demography and demand into something that was sustainable. That model of how to achieve change is something we've stuck with over recent years, and we've stretched those targets to respond to austerity and to reductions which have totaled some 28% in expenditure in adult social care, albeit that more of a priority than mainstream social care, mainstream services across the rest of the council. So adult social care has had some protection within the council, and then the benefit of better care fund and other resources released through healthcare. What this slide shows is that we've tried to change some of how we respond to need, which would be the top line, and what a cost for needs remaining constant would be is shown by the left to right top line, by first of all using informed choice and some of how we meet future need. Then in the claret box, how we've used enablement to reduce costs for care, how we've changed in particular the use of supply by using individual budgets. Nearly 20% of our service users use direct payments. There are restructure costs and maximising charging. But then you can see as we enter the bottom, the sort of sand-coloured and light blue-coloured show the increasing use of temporary funding to manage the gap between where our budget is, which is the bottom right-hand corner, and where our savings programmes have got us. And essentially one of the problems sitting underneath Birmingham's current budget problems, but those are replicated up and down the land, is that we haven't been able to make a transformation approach stretch to the resources that we've got. And we've particularly been awaiting how we get a public pound solution across health and care to further bridge that gap. And those are the challenges writ large in our budget. In the next slide, I've set out some of how we've tried to achieve some of those ends, just to give some reassurance or some picture around the complexity of that picture. On the top right, left-hand side, our amount spent on bed-based care has reduced quite significantly. Tribute to John Bolton's work around how to improve efficiency. We've had a big drive on maximising the use of community expenditure. Indeed, nearly 80% of our expenditure for younger adults is in community settings, and 2/3 of it is similar for older adults. You can see that until this year's surge, we've done better on reducing delayed transfers, so we hadn't achieved this by, if you like, false economy and blocking demand. But the bottom two lines show for older and then for younger adults, left and right respectively, how actually contrary to the national trend, demand in Birmingham for services has seen an increase in the people served. We don't fully understand this curve because it's particularly for older people, it's against the national trend. You can see on the bottom left-hand corner that the number of people being served in Birmingham, as per national averages, fell in the first few years responding to austerity, but has recently started to climb again above the number in 2010. We're not fully sure of all the reasons for this, and clearly are allocating in relation to substantial and critical need. It may reflect, in particular, the issues about serving a population with higher health inequalities and the need for care, particularly public care, therefore rising steeply. We think the younger adult projection on the right-hand side is a particular feature of serving a young population, and in particular, how that demography for younger adults is working into adult life. So that's just showing you some of the challenges that face us with a transformative approach in which digital technology and e-marketplaces has been a part of a strategic agenda that's focused around themes that are recognisable up and down the country. We've tried to use approaches which essentially are more personalised, and where marketplaces and other solutions put people in control of the choices that they are able to make and the way in which they exercise informed choice within care. We've put a great deal of stress, if you like, on independence, by which we mean, I think, a greater life at home or within the community, and enablement, how to enable people to recover and restore life quality so that they can resume looking after themselves. How to build up community capacity and resilience has been a part of that work. So again, trying to think about how we strengthen communities and strengthen people's knowledge of what is within those communities. So again, how the marketplace forms part of not only accessing care, but also thinking about how you access what might be around you within your community, either geographically or particularly within communities of expertise, and share knowledge and skills, something I think particularly carers can teach us a lot about. And increasingly, responding to the challenge, particularly in relation to money, the answer has been said to be integration. I've put a question mark in brackets really around whether actually are we showing now that we don't yet fully have an agenda about integration. The STPs, the Sustainable Transformation Plans submitted by the NHS in the last week or so, I think show how a sustainable health service might be achieved, and there are some difficult choices that face us. But in the words of Stephen Dorrell, a castle on a hill isn't necessarily a good solution unless we integrate a solution that includes social care and broader community services. Then the NHS itself has question marks over its sustainability. And for me, that raises questions about whether we should actually start a different approach to the one that we've set out. The dictionary definition, and I use the Cambridge Dictionary in tribute to where I was brought up, defines transformation as a complete change, especially so that there is improvement. That it's something in which you can guarantee to people that what you're doing is a change process that will lead to improvement. Perhaps what we're seeking now is a license to experiment in the hope that it moves away from well-described burning platforms, and what we're trying to get to is a shared sense of how, with citizens, with carers and with others, and in a collaboration across public sector, we might be able to do something different. That, I think, requires a different language than professing that as experts we know somehow that that automatically equates to improvement. We are in an era where the sustained austerity is a real stretch on our capacity, and where I think in particular we've yet to see how we address whole system change and how we license that whole system change. I think it's also important to remember that it's not just about the system, it's also about people who need care. And increasingly, what we're seeing in the lives, particularly of people who are disabled, or those who provide informal care, is the multiple impact and the stress and strain upon their outcomes from multiple cuts, whether that be in housing or in benefit or in care, and those kind of multiple impacts, which I don't think we yet fully understand. So, that's a point where, if you like, the landscape has been set out, and where there's an opportunity, I think, to take some questions before we move into, well, how might e-marketplaces and digital be part of a solution to that context?
Okay, thanks, Peter. So, first question we've got come in is from Paul. He's asking, how are you measuring community capacity and resilience, and what does good look like?
Well, that's a cracking first question, isn't it, really? I think that's actually part of the problem, that in relation to what we're trying to achieve through integrated services, do we fully understand what does good look like? What does that mean? One of the things for me, the journey with health towards the Sustainable Transformation Plan has exposed, is we might talk about how you create more services in the community, but we don't necessarily mean the same things. So for me, community capacity is about how I would build services around my life, my house and my surroundings, and indeed, say, peer networks, to support me in living the life I choose to lead. That's very different from a description which is based around a set of community services. So I think this is part of the journey, and part of why I'm anxious that words like transformation exclude the expertise of citizens and people using care about exactly what do we need to have to reduce the demand and costs upon services. And I think we need to be really careful here too in setting out that which is about avoiding cost. So in other words, by doing something differently, we might avoid a use of health and care services, and that which is in effect removing cost, i.e. I will no longer need X, clearly, and I can remove that money. And sometimes when we blur those two, we end up really disappointed.
Okay, thanks, Peter. We've got time for another one just at this midpoint. So there is one regarding what approaches would you suggest to enable the staff and citizens to feel that they are helping to shape and drive this creation of an e-marketplace, and they're not merely recipients of those changes.
I think that's part of the thinking I've been putting into this presentation and elsewhere, particularly as we've come towards the end of the sustainable transformation planning with the NHS, and Birmingham, along with at least one other council, have been clear about needing to make public those plans, given council's full involvement in how those are. That hasn't been a process that's had a great deal of citizen engagement, and certainly couldn't be claiming to move towards that more co-production method that's begun to emerge much more strongly in social care. I think if we're going to run a health and care economy with the money that we have available to us, we have to be clear about that resource envelope and be inviting people to work with us on a challenge.
Yeah.
And it is a challenge to use all our resources, of which the money is a part, to fit the challenge, the demands posed upon us by demography, by the great news that we're all living longer, or that we're living with more complex disabilities, or more demand for mental health care. As I'll show later in the conversation, Paul Burstow, in his appointment here to the University of Birmingham, is arguing using what we already know about diagnostic rates in mental health and undiagnosed rates of mental health, if that makes sense, as well as what we know about children and young people, that we're never going to meet that demand for treatment, in inverted commas, by employing more psychiatrists. So how do we all play a part in creating our own resilient mental health and that of our neighbours and friends and communities? And I think that's an invitation. And at the moment, I think, particularly with, and I'll hold myself guilty as charged for this one, how has transformational methodology, which did initially start very strongly with co-production, move into a resumption of that kind of approach and openness with communities? Many of you may be well aware of the work of Clinton Farquharson, who's been one of the citizens here in Birmingham and Solihull, the West Midlands, and indeed beyond, through his work with transforming the TLAP and the rest of it. Clinton has written a very recent blog saying how suspicious he is of some of this language, that essentially it's a language about cuts, as opposed to a language hidden behind a promise of improvement. And I think we've got to be very careful about how we position and think about how we invite people in to a conversation where we don't fully know how we're going to achieve some of that, and perhaps be more honest about what that journey is.
Okay, brilliant. Thank you, Peter. Well, I think that's a great opportunity to probably pick back up on your slides. Let's move on to the second part of the conversation. Please do keep your questions coming in, and we'll be covering some more at the end. Thanks, Peter.
So just a quick opportunity to kind of think about, well, how might digital technology be part of a solution? And I just grabbed a couple of screenshots because I think it's not the tool itself. Nobody's going to claim that if you put in place an e-marketplace, wham, all your problems are solved, your budget comes in online, all your citizens are happy, and the job's a good one. It's part of that. And I picked these screenshots because I think an important part of it is actually the way in which this is structured, and the way in the marketplace is structured in particular. Information is power, runs the old adage, and you can see here how power and information can shift into the hands of the citizens. Questions like, who would you prefer to arrange your services? Choose where you'd like to look. Those are about how to become an informed customer and how to take some power in the situation. So that for me, the e-marketplace, the emphasis is not necessarily on the tool, but it's on the approach and the values that you're trying to bring to how you're going to meet the challenges which I've just set out. I'd also like just to take a moment just to stop and remind us all that an important part of the social care market sits outside that which the local authority directly funds or commissions. Think about the amount of self-funding already in our residential care systems, or using things like the equipment shops that seem to be on every high street or in every newspaper about how to buy equipment, and remember the importance of self-funding in today's social care system. And it's really important that councils have a clear offer for the entire population that need care and information. If we're not playing a part in shaping and determining where some of that self-funding goes, that actually shapes and determines the market off which public funding works. So actually my first argument for why I pay attention to that is it's in our interests in relation to market shaping. But secondly, I think it's actually very importantly a part of how we make an offer for all our citizens, and how councils don't just get trapped in providing an offer for those who, in inverted commas, qualify for local authority assistance. Actually, all our citizens matter, and it should matter to us that those who are using their own resources to buy their social care are getting good, informed choice about how they do that. So the marketplace is also about thinking about the market in the broadest sense of all those who might be buying. Moving on to what's important in relation to values and principles for where we're at the present stage, and trying to think through how we set a market using, I think, effect the principles that I said from Paul's speech. If it's not beds and doctors in effect, what is it? Here in Birmingham, we've been very clear that what we're trying to do is to set out an approach that's based upon how much money as a percentage of our total spend we're spending in community settings, and within that total, how much of that is being spent through direct payments. In other words, how much real power, money, is spent directly by the citizen in their own way, slightly different from a measure based around individual budgets. So something about what are our core values and principles, because it's within those that you shape your deployment of technology. And particularly how technology can be part of a co-productive landscape, how it can be part of building more personal solutions, is something I think we've got to think through. But I think what this core set of values and principles is, and I would not claim to have an exclusive hold on that, is something that we particularly need to fashion through. So that, as I alluded to already, if the sustainable transformation plans are about a sustainable NHS, that's a very different place to a sustainable health and care system. And what would a sustainable health and care system need to look like and what be based on is, I think, something that we've got to have a significant debate about. And I see the Sustainable Transformation Plan in effect 3 stages, which we're moving through at the moment. But the first part, the submissions that have probably all been made over the last week, are probably most about the sustainability of the NHS. That there's a second phase, particularly here in Birmingham and Solihull, where we've identified the gaps facing us in social care, but have yet to move to how are we going to solve them, about how we become a sustainable NHS and social care system. But I think there's something broader than that, about, well, what is the truly sustainable systems approach? I alluded in my answer to the question about Paul Burstow's treatment gap in mental health, and the beginnings of a conversation led by Paul about what's that new narrative that we can't just buy our way through this problem of the demands and demography and needs of the 21st century, that we need a new narrative about how to approach closing these treatment gaps, or closing the gap between needs of older people and a health and care system. So something about that as a staged approach. I think it's also important to remember that whilst there's a small evidence base, there's the beginnings of some evidence base about how digital technology and e-marketplaces might play a part of that. Some very positive work about how user, patient-led reported measures in mental health work. The work done in the States about the medical home, where continuous relationships and interactions between the citizen and those providing care and health made a significant difference to quality. There's the electronic health records research, which is mixed. There's our own experience too, of markets. There's also the work that Shirley Ayres has done, and I think she's listening in somewhere in her Click Guide on Dementia, where she's shown there's little awareness of e-marketplace, but makes very powerful arguments about what the place of digital is within the landscape of care, choice and control by citizens. And there's certainly some really powerful learning for us about where we see e-marketplaces within that broad market. At the moment, they're all things that sit on perhaps council-based website. Is that the right place? Does that work best for self-funders who don't see themselves, for example, as coming to the council? And I'll say also something about thinking through about where we see e-marketplaces within our own experience of markets. Where do we want to use them to stimulate choice, competition, innovation? Are these just access traditional care services, or are these about stimulating that community layer and our engagement with community services that are out there and our knowledge of those things? So something about thinking through that. And I've put here, if you like, market choices that shape my care. I guess the word market is controversial, but essentially I want to build my care around the things that matter to me. And that e-marketplace, it allows some of those tools. So how do I make choices about housing, particularly that might be designed for old age? Perhaps it's because of the job I do, but I'm very aware that my family choice of home, where we live now with teenagers, isn't going to be the sort of thing that works for me in 20 years' time. It might not be the sort of house that works actually for my parents to visit me and my family within the very short term. So what's housing that's designed both around my needs as I grow old, but also actually my ability to play a part in caring for others who are growing old around me? How do I structure my time? Actually a really important question, particularly for adults and citizens needing care, is actually about that use of time. How do I choose to spend my day? Some of the things that we learned when we introduced individual budgets and direct payments to people who'd spent a long time in day services was that ability to take control of how I spend my day. How do I look after my well-being? I'm constantly surprised by the need for low-level equipment, things that can make a huge difference to quality of life, whether that's using taps or working with a cooker or filling a mug with hot water. All that knowledge about things that can make a difference to what it's like to live with some low-level, long-term conditions, and access to knowledge of things about equipment that works, access to knowledge too about what others' experience has been. In shaping my care, particularly the way I work, is I like to use a lot of information, peer knowledge. Some of the things we've learnt too from the national organisations which provide support to carers is how that peer knowledge and peer support takes place in the small hours or at odd times of the day and night, the points where carers aren't facing the huge stress and strains that come with providing very large amounts of informal carer support. How do we provide that present support and knowledge and help people access that in those small hours of the day and night at a time that suits them or works around the way in which they now live their lives? How do we personalise care? How do we allow people to choose who their care team is? All of those kind of things that are within a marketplace. And as I say, I think particularly how we're thinking through the information is power adage to create knowledgeable consumers, the expert by experience, the expert patient, and how that makes informed choices. Because actually I think for most people, for almost all citizens, it's true that we don't want to see more money being spent on us that is necessary, and actually get quite critical of some of the waste by not using our expertise. How as co-participants can we help take some of that responsibility? So I'm trying to shape that, how a marketplace is part of how you can shape responses to care and health. So what we've got in conclusion is a massive challenge, as we all know, for social care and for the NHS to show that it can be sustainable, both as a care system and a health and care system. And I think there's a lot that social care can help with and bring to that discussion, particularly in how we help the NHS find answers that are outside of it, rather than working from the NHS inside out. And as I say, digital and e-marketplaces aren't automatically going to open the box to solutions, but if they are part of a set of values and approaches to work that value the capacity that people can bring and value a way in which we can create informed and knowledgeable citizens who can help us with co-producing in a time of scarce resources to source solutions, then we might start to find some ways forward out of what remains an incredibly challenging landscape facing care and health today.
Brilliant. Thank you, Peter. Well, I think it's probably best for us to move on to the full Q&A session. That was a fascinating insight into the role of e-marketplace and how it's really transforming care services here in Birmingham. We've got several questions come in. We've already got these all lined up. Like we said, if there's any other questions to come in, then please do type them into the box on your screen and we'll invite Peter to answer them. We'll try to get through them all between now and the end of the webinar. But if we run out of time, Peter will be responding to the questions in an offline interview after the webinar, which we'll be publishing as a follow-up. So, like we said, if we don't manage to cover them today, there will be opportunity to have them addressed at a later stage. So I think, Peter, we'll just continue with a couple of the questions now. We've got one coming from Helen, who asks, do you think the solution or even the challenges would be different in a rural rather than an urban context?
The technique may well be the same. I mean, having had the joy of, through my ADAS roles and the rest, of seeing more than just Birmingham, the challenges in an urban setting versus the challenges in rural settings are very different. And some of that, how do you get choice and control in remote villages, all of that kind of stuff is really difficult. There have been some great localised responses, some of the work done in very small rural communities to create community wardens, to create community capacity. There are villages that are set in small towns that set them challenges of not letting people with dementia leave the community to go into residential care and try to set those. So there are some ways in which you can make it work for you, and I think that's what people have to think about. It's been an issue in Birmingham. Everyone says, you're far too big. How do you make your size work as an advantage rather than a drawback? So how can you use rurality or urbanness to work for you, and how do you use tools like the marketplace, but particularly, as I've tried to argue, about how you use it to help you with an in-depth understanding of what might be available in your locality and how you can draw that in. So you're trying to shape where people can get solutions to care and how they can access it.
And talking specifically about My Care in Birmingham, the platform that you have, how do you measure the impact of it? What does success look like to you when you've rolled out this e-marketplace?
I think it's a fantastic question. I think one of the things we've been very clear about in setting up our transformation approach, one of the things that councillors across all political parties were clear about, is that there's a danger that the social care offer becomes defined purely to those that qualify through eligibility and through financial means for social care. What that effectively equates to is that if you're able to fund your own resources, in other words, if you're a homeowner, particularly with the way this has now been allowed to accumulate over time, you're not going to get state help. And members were very clear that we needed to have an offer to all citizens. So that the marketplace was in part not only about those using, if you like, state support, but also those who might be using their own resources, and the group in the middle who are drawing off a bit of both. And some of how I think we see that success is the number of hits, if you like, that the marketplace takes. So the marketplace takes up to 13,000 visits in a month to it. We know that they spend a lot of time on that. Average search times within it are something like 15 minutes, which is apparently, in web technology, that's something that you would want to have if you're spending that amount of time. We can see the number of people using the online assessment and planning, so if you like, shape how they see their needs and how they might be met, and some 500 people a month are using those tools. But what's also been interesting is how many people go straight through to starting to buy services, to starting to access that. And again, that sort of ranges to something like about 5,000–6,000 people every month going through into those kind of things. If you think that the social care system, through all our call handling, handles about something like 85,000 contacts a year, you can see that MyCare in Birmingham is reaching bigger numbers than historically social care has reached if you count the totality of all our contacts over a year. And I think in particular how it shapes and offers something to citizens who either wouldn't see themselves qualifying or want to purchase their own, or for various reasons. Some people think an assessment methodology is too intrusive, but they'd much rather arrange their own and not come through an assessment process. It allows all of those kind of things to happen. So for us it was that very clear strategic success measure about there has to be something for everybody in the city, whether they're using state resources or private, and something about the volume of activity and how that's shaping. And I think particularly now as we think about what the next generation of e-marketplaces are and where we locate that and all those kind of things, some of how we would pay more attention to what those metrics would be behind it would be, I think, something we'll give a lot more thought to.
And in terms of those metrics, how many citizens who don't qualify for state support or might not qualify as far as they might be concerned, are you actually helping? Do you have visibility?
Yeah, I'd love to be able to tell you that one. That's the sort of thing where you'd want to start to increase visibility. And indeed, some of the options now beginning to emerge as people think about products in the marketplace of marketplaces is how you might actually be able to start to track spend, all of those kind of things. We know that we've got 1,600 providers. We know we've got some 8,000 adverts on there. So we know that they take nearly 30,000 hits a month on those sort of pages. So a lot of demand for information around those services. What that translates to in purchasing and by whom, so that you start to develop those kind of really good customer understanding metrics that you can get, the sort of power that Tesco's has, is something I think we've all got to pay attention to in the future. And particularly if you're then going to link that to, by doing this, we're going to see a change in costs in the care and health structure, then the power of those metrics is all the more important.
Okay, you've probably touched on this a little already, but why is it important to get both community and private sector providers on the e-marketplace? What difference does that make to citizens?
We put a lot of effort into the breadth of services that are available in there. You want it to be a comprehensive information base for a start. You want to be able to put forward a comprehensive range of solutions too. And I think in particular how you move it from just being, in effect, when I trained and went for, we now look back and say, well, in effect, we used to either offer home care, daycare services through day centres or residential care. You want to get the breadth of different things about how people can shape their lives, their time, their support in very different ways. So you've really got to work, and one of the things Birmingham's done really well, I think, is work very hard at trying to get engagement by the provider side to get all of that, and being very broad in our interpretation of provider. So as a good example, when one of the blind test sites did to check it, went and looked at the supply of hot meals, something the council no longer does. We put that all to market, and you found everything from big providers that provide frozen meal choices, some bigger providers that provided hot meal choices, to actually young people that had set themselves up, having got the right qualifications out of colleges, to offer discrete, some gourmet, some budget. So you've got every type of range within there. And that's the sort of thing you're trying to do to stimulate choice and control and the sort of offers that people want.
Okay. And what are your citizens generally saying about MyCare in Birmingham? What's the feedback that you've had generally?
Feedback, as I say, has been generally positive, and usage rates are probably the best illustration of that, because actually and we designed it with people and tried to also design a lot of the questions to follow what people's needs and requirements are. So a great deal of thought goes into the design of the product, all those kind of things.
Okay, we're just going back and looking in the questions that have come in. So Mark from Essex County Council, quite a long question that's been asked here, but how integrated is the e-marketplace with the rest of your IT system, or specifically your social care system? How is
not integrated enough. It's a great question, because again, I think it's about thinking through. Look, Birmingham was in the first generation of these things. Actually, if you were doing it now, you'd be trying to maximise the integration with other systems so that it does feed on and off council platforms. But also, I think thinking through, where would people find information? Would they naturally think about going to the council website, particularly if they're self-funding? So again, trying to think through all of that, and that needs, I think, a great deal of care in an era where we've also got combined authorities emerging, where there's some really powerful stuff in the third sector. How do we link this up so that people have got a good chance of getting the right information? Because ultimately, I say, we're trying to get a good response to our citizens and help shape the Birmingham offer by doing so. So it's in our interest to make sure we get the footprint and the usage and the profile of this absolutely right. And there's almost a question of it just through the council's website, and how might also you integrate that off NHS or indeed other people's websites.
Okay, thanks, Peter. Mark, there was more to your question which we'll look into further when Peter has his Q&A after the session, so we won't neglect to address some of the other points you raised, but it was quite a long question, so hopefully that's touched on the first bit of it. If we move on, we've got a question from Chris from Strategy Realisation, who says self-service via a marketplace makes a lot of sense for younger people, but the over 80s are, rightly or wrongly, usually seen as less web literate. How are you dealing with that issue?
Great question. We put a lot of thought into that and wondered whether it would be used a lot by older people. Actually, one of the things we have done is dive down and look, and we are seeing quite significant use, particularly by self-funding older adults, and probably at an earlier stage than care need. So that equipment, things to support me, those kind of areas are getting quite a lot of direct spend, direct activity by older people. What we also see and can track is we see about 3,000 family representatives, family members in the marketplace every month, and they primarily are looking on behalf of older people living in Birmingham. So they tend to be the very involved, connected son or daughter trying to seek care for mum or dad who lives in the city. And that's been an interesting development too, that it brings them closer to being able to source solutions. And some of how providers have been able to respond is actually using technology back. So actually there are some providers that now very clearly shape their offer so that son or daughter purchasing care from, I mean, it's a shame they live outside Birmingham, but let's say in Essex, because that was the last place mentioned, son or daughter in Essex gets a text to say that home care has been. Very simple tools, some used by some care homes, for example, to put online who's on duty today, what have people had to eat, what have the activities been, so that if you're phoning your mum or dad, you're actually able to start a conversation with what's going on, rather than asking people who might have a degree of confusion, what have you done today? Yeah, so really good techniques beginning to make that a two-way process, not just families coming on behalf of people to obtain information. So it's one of the other great things for Birmingham is that we know that we have the highest percentage of people with handheld IT kits in the country. That reflects our age, but it's also important too to continue to work with IT for older people. So actually also the other thing we've got is lots of offers to help people with IT access, familiarity in old age, and we've done a great deal to encourage that.
Okay, we've probably got time for one last question. Joe from Kent County Council has asked, having used a whole council approach to transforming social care, You mentioned housing, leisure and other lifestyle factors that affect the ability for social care to plan and deliver services differently. So how did you engage other directorates in your plans?
So I think the honest answer to that is yes and no, if that makes sense. There are some bits of that where we have managed to engage as a whole council, and others you'd want to do better, and others we've learned from experience. Probably on our strongest side has been the work that we've done to develop extra care housing offers, and in particular the work we've done with Extra Care Charitable Trust. We opened this year the 5th village, taking I think the most village place in the country, particularly with an emphasis that is around the mix between self-funding and council supported. So again, it's a market intervention because those with equity will always be able to find housing solutions in old age. Those without it won't, but it's a mixed offer. And if you look online on the Extra Care Charitable Trust, you'll also see some fantastic university evaluated research showing that that is making a big difference to care and health costs and outcomes. What also that does, and why it's a good example of a joined up solution, is that has released about 800 family homes back into the Birmingham housing market. So you're not only getting a solution for older people that improves their health and care, you're also expanding the stock of housing at the same time. So that's something where I think we've been very joined up as a council. How to make that broader offer around leisure and communities is something I think we're all working with and can all think through again. And clearly, I think what I'm also trying to get at in the SDP is when we talk about health and social care is proxy for a whole set of community services. And I think how we bring that to bear and make a difference upon the health and care system is going to be the challenge for councils as we embark on the next stage of the SDP journey.
Okay, just looking at the time, we probably do have time for one more. We've been asked, how have you involved service users in the design of My Care in Birmingham? Did you involve them at all in the development of it, of the marketplace?
We did, and there was a lot of involvement in the product side too, so to actually make sure the product works, that's an important part. And we involved a lot of service user engagement in the kind of what do we want to do, what sort of knowledge would we be looking for, so on and so forth. I think as ever, once these things start to stabilise, if you like, or become more mainstream, then you kind of move away again. And again, I think we're probably at that point where thinking this through again about what's the next stage in a more co-produced way is probably really important that we pay some attention to.
Okay, brilliant. So there have been a number of questions still firing in. We are probably beginning to wind up now. I'm just looking at the time. Peter, did you have any final thoughts that you'd like to add, or anything on closing that you'd like to say?
Looks like we've stimulated a lot of interest just seeing the questions board, but of course obviously we're audio, so you can't see it either, so there's an awful lot of interest in there. And I think what I think would be really helpful is to start, because I wouldn't pretend to be presenting here a set of answers. I think I'm presenting, this is a tool within which you can get a lot of purchase on the sort of journey that I think we all want to make to tackle the challenges that face us in our care systems, or more broadly in the health and care system. And I think how we can build kind of expert communities, knowledge, all of that kind of stuff is really important to work our way through. And there are some great questions. There are also, I think, people look at the board with some good examples of some of those shared solutions. And so I think the next iteration of e-marketplaces is there for us all to learn from, and how we share that learning across what is ultimately a very generous local government and citizen community is going to be really important.
Okay, thank you, Peter. Well, like Peter said, we've had lots of engagement online with the questions, so thank you so much for everyone who's taken part today and everyone who's posted a question. As you said, Peter, we'll be following up with a Q&A offline straight after this webinar, and we'll be making that available along with the recording. Thank you, Peter, for joining us today. It's been absolutely fascinating to hear from you. Thank you also to everyone who's attended, and yes, please join us again for another webinar. Have a great day. Bye-bye.